wishes all the listeners to a happy Easter. And let us begin the session. And today our guest is Dr. Suraj Singh Bhadoriyya. And he has completed his MD and doing a PhD scholarship. And he is working as an assistant professor, Department of Homeopathy Pharmacy, Pearl Institute of Homeopathy and Research, Pearl University, Vadodara, Gujarat. And he has presented so many research papers in this forum. All the papers were really wonderful and really, we are very happy to say that all the papers were presented in this forum were read as well as uh, watched by many of our followers and got very good support, very good reactions from them. And anyway, today he has presented not only these research papers, but he has done so many works in homeopathy. He has completed the college, lot of works in along with his college as well as in other sessions. Also published so many research papers. More than 15 research papers were published by Dr. Suraj Singh Bhadoriyya, and he has attended a lot of workshop and is doing a PhD now. So let us, today's subject is an interesting one. As you all know that we used to say that a drug, then medicine, then remedy. Some people believe that all are one, but what is what? This is the session Dr. Suraj Singh Bhadoriyya is about to tell us, and let us listen what is a remedy, what is a medicine, what is a drug. So we proudly invite Dr. Suraj Singh Bhadoriyya to this session. Welcome, Doctor.
Before Dr. Suraj Singh speaks, I would like to welcome all. And while he is uploading his PPT, I would like to congratulate everyone today on the Easters, and today being the Easters and also the birth anniversary of our master Dr. Kent. So I wish all the participants a very happy Easter as well as very happy Kent's birthday. Thank you. And now, Dr. Suraj, you can start your session.
Thank you, sir. You are muted, Dr. Suraj. You are muted. Please unmute and begin the session. Yes, Doctor. Please unmute now. Okay, once again. Now, yes, once again, try. Please unmute. Yes.
Now my voice is audible, sir?
Yes, now it is everything fine.
Okay, sir. So first of all, today we started this topic, drug, medicine, remedy. So from the Department of Homeopathic Pharmacy, it is very important to know about the characteristic feature of medicine, characteristic feature of drug, and the characteristic feature of the medicine. So today, first we understand what is drug, what are the different types of drug. So basically, drugs are those substances which are generally used to prevent the disease condition, abnormal condition, which is away from the physiological condition. So it is generally based on the pathology. It is generally based on the disease condition. So generally drugs are those substances which are used to prevent the illness. Generally these drugs are acting on both the dynamic plane as well as the organic or the anatomy of any living entity. Here you can say drugs are generally the crude substances. They are not the formulary part like a medicine. So generally drugs are those crude drug substances which prevent or which relieve the symptoms of a disease or some abnormal conditions. So generally, these are the drug. Now, what we can do when we categorize this drug into various classification, so it is divided into various subtypes. What are the subtypes? Now it depends on the different action of drug. Now let us see the different action of drug. When we talk about the action of drug, so generally it is acting on both mental as well as the physical ground. So here we can say the drug which has action on the dynamic plane and drug which has the action on the organic plane. So generally there are two main category of drug. One is dynamic and another one is the pathological or the organic one, which has the action on that particular mass or the material in any living entity. So generally, when we talk about this, so these are the different route of administration through which the molecules of drug were transferred into the different system of human body. So generally, it is the branch of pharmacy, which we can say pharmaconomy. So generally, pharmaconomy means it is the branch of pharmacy which deals with the transformation of drug through the various route. So that we can say the consumption of drug molecule. So here the consumption of drug molecule were seen by a various pathway. So what are the various pathway? The first one is inhalation. This is also known as olfactory route. So in this route, the drug molecules or the drug particles or the drug phytoconstituents were inhaled by the nasal mucosa or the nasal cavity, and these particles, these nanoemulsions, these nanostructures, because ultimately we are using the ultra high dilutions. So these nanostructures, these invisible particles were enter into the nasal cavity, into the nasal mucosa, where they are sensitized by the nerve ending. So this is general way of action on the nasal mucosa. Generally in the nasal cavity, there are some minute nerve endings. And when we go for this inhalation and olfaction, so these drug molecules or the particles or the vapor or the volatile substances get sensitized into the nerve ending. So this is the one of fastest route of drug administration. What it is? It is one of the fastest route of drug administration. So generally in olfaction, we use this route of administration in those patients who have some CNS disorder, like some patient in coma. So generally we are not using the oral route of administration or some other route of administration of drug. So in that condition of any living entity, we use this olfaction or the inhalation process. So here, when we use this inhalation, so it is one of the fastest route of drug consumption. Now, moving towards the second consumption, that is the injection. Generally, this injection, it is not applicable in our homeopathic route of drug administration. Why? Because our medicines are ultra higher dilutions. They are very minute massless particles. They are very invisible, very nanostructures. So that's why they are not to be given, injected, or via any venous system or the blood circulation. That is the explanation why the injections are not to be applicable in the ultra high dilutions. I am not talking about the concentrated part. I am only concerned with the ultra high dilutions. So whenever the homeopathic medicines which are ultra high diluted, they are not supposed to give via blood transfusion or the channel of blood or lymphatic system. When we do this, so ultimately we are going to hamper or more deviate to our vital system. So generally it is only for the general or modern pharmacology. So got it my point? My point is more concern about this injection, because in pharmaconomy, this inhalation, the oral, sublingual, and the dermal is very satisfactory answer. But as from the people of pharmacy department, we have to understand the general idea first. Then we understand our pathy. What are our limitations or what are our scopes? So why inhalation or why these injections may differ? So generally this injection route is not applicable in ultra high dilutions. Okay, because it is very debatable and very controversial part in our homeopathy. Most of them are in the favor of injection. Most of them are denying through this pathway. So what is the justification for this? So the justification is because of the ultra high dilution. So generally when we use this pathway in modern pharmacology, so our drug molecules are transferred via the bloodstream to the target cell or the organ where they are going to act. Moving toward the third point, that is generally smoke. There are few drugs which are taken by the form of smoke or the volatile substances. Generally, in our drug, there are n number of phytoconstituents. Some are volatile, some are non-volatile. So, volatile are those constituents which are easily get absorbed via olfactory route. So, these are generally the smoke part. Got it my point? But generally in case of this smoking, it is not regarding with only the cigarette part. Smoking generally regard with the conversion of this transformation of nanoparticle in the form of smoke. Because here this word is smoking, so you may get confused about the transformation and the pharmaconomy of this particular point. So generally it is regard with the smoke. Next one is ingestion. Ingestion, that we can say the oral route of drug administration, which is very commonly used in our clinical practice. So ingestion, it doesn't mean that we go for the digestion. In our homeopathy, the route of drug administration through the oral route is generally a very common. So what happens when we take any ultra high diluted medicine through oral route? So via this through oral route, there are certain pores inside the mucosa of oral cavity. So when we have these medicated globules over the surface of tongue, so when we go for this salivation, so this is going to absorb via the pores of oral mucosa in the case of oral transmission, yeah, oral route. So when these nanostructures, or when we supposed to talk about these nanoparticles, so they are getting absorbed through this oral pores or the oral mucosa pores. So it is very sensitized part. Now generally what we can do when we took any homeopathic medicine, so before treatment, after treatment, there should be empty mouth. So why? So the answer of this question is because of the pH. Generally when we took allopathic medicines, so there should be a compulsion of some eating material, some dietary material, or the water also. But in case of homeopathic medicine, as we know, our medicines are not to be given in the concentrated part except the mother tinctures. So when it is to be a ultra high diluted, so there should be emptiness before and after treatment. Treatment means the taken or the route of administration. So before and after, because it maintained the pH of that particular oral cavity. So we have to understand that particular phenomenon or the scientific background why we are not going to consider the vegetable or the meal item while taking or having the medicine. So oral is another commonest method, but it is restricted whenever there is some fungal infection in the oral cavity, whenever there are some ulceration, whenever the mouth is not going to open properly. So in that condition, in severe inflammation, we go for the olfactory route or some other route of drug administration. So generally it is having such limitation in the oral pathology. When we talk about oral administration, so again it is very important that it is also going to give a fastest action when it comes under or beneath the surface of tongue. Afterward, when we talk about the sublingual action or the sublingual muscle, so it is also the fastest route of drug administration. So next is absorption via a patch on the skin. Now generally over the surface of skin, when we go for external applications and when we go for this ointment, lotion and element in the general skin lesions or the pathology related to dermatitis or some other skin diseases or the disorders. So this route of transmission is generally used for the local application for relief of pain, swelling and local infection or somewhere the dryness. So it is very important that why the skin route is commonest. Generally it is used when there is some diseases of skin, whenever there is some psoriatic lesions or eczema or fungal infection on the superficial surface of skin. So by giving the oral most minimum suitable single simple remedy, we should also go for this local application whenever there is more swelling, more congestion, more vesicular eruptions, more dryness, cracking. So in all this condition, we go for this skin or dermat, the surface of this route of administration. So whenever we go for this, so first we have to formulate our drug in various external applications. These external applications are made by certain drugs. So they are said to be the medicated external applications, not just like a plain any glycerin or the glycerin. So when it is mixed to be the mother tinctures of various medicine, so it is to be given or apply over the surface of skin. So this is the another route of or consumption of drug molecule. The last one is the dilution under the tongue. So generally it is beneath the tongue due to the sublingual muscle. So it is one of the fastest route of consumption of any drug molecule or any drug particle or any drug constituent to the target cell or the target tissue of the living entity. And generally, when we talk about the cardiac pathology, so whenever there is a cardiac arrest or whenever there is a myocardial infarction, so we generally use the modern pharmacology or the drug from this modern pharmacology system. So suppose there is some like aspirin or some other medicine, so they are generally used to given beneath the this surface of tongue. It is under the surface of tongue. So this is in homeopathy also, whenever there is a acute emergency or some other critical condition, so we generally use this type of route of drug administration for the fastest action and the acute emergency. Why? Because of the sensitized nerves or minute nerves which are getting sensitized by these nanoparticles, and then they are going to transfer the impulses from the oral cavity to the CNS. Then from CNS, there is a efferent nerve which gives these impulses to the spinal cord where it gets terminated, and from this spinal cord there is a motor nerve which is going to supply a various viscera and the part of living entity through which it is going to act. So generally this is the neural pathway, how the medicine gets sensitized into that particular nervous system, and when this nervous system goes to CNS, and again the impulses transmit to spinal cord where it gets terminated, and the motor nerve, let's start with their pathway. So how it is going to act? So it is just a part of neural system. So these are the various route of consumption of drug material through which it is going to act. Now let's come to the another slide. Types of drug. Now these are the different types of drug as per the different their action. As we know, the action of drug, it is known as pharmacology. What is pharmacology? Pharmacology is the branch of pharmacy which deals with the various action of drug. Now the first one is depressant. What are depressant? They are those drug substances which are act on central nervous system to depress the action of CNS. Like there are two different action on neurons, depolarization and repolarization. So in physiology, we already learn about this transmission of impulses whenever the sodium potassium pump opens. So the sodium and the potassium gets transferred via the cell wall of this axon. So there is depolarization and repolarization. So there are certain drugs which are said to be a depressant. So whenever they are depressant, so they are going to depress the central nervous system. Got it my point? This is very, very important to understand how the homeopathic medicines are said to be a depressant. At always, when we talk about the action of drug, so we always have only one single statement. The statement is our medicine has affinity on vital force. In terms of organon of medicine and the homeopathic philosophy, I accept this. But in terms of the modern pharmacology, because now still we are not EBM, so we have to try to understand why our system is not to be EBM. So we have to also explain, we have to also understand how the drug act on the various system of living body. Whenever we are not going to consider this part, and when we always talk about only the philosophical background, so it is not justifiable to our pathy. Even though I know there are certain diseases in which this medicine has a wonderful action on central nervous system. There are so many medicines which act on the sodium potassium pump, or they are used as a anxiety neurosis or schizophrenia, seizure, or some other illness related to the CNS, but still we are not going to prove it. So rather to speak only the very good sentences on our slide, but it is also our duty to also explore our lacunas, our weak point, so that in future, in our next generation, we have to fulfill some gaps in our pathy. So this is generally a depression. Now, what are hallucinogens? These are the drug substances which affects on the senses of our living body. So generally they are going to have the affinity to change or modify the physiology of this sense organ or this sense part. So these are the generally hallucinogens. They are those drug substances which cause alteration in our senses. You may have some diplo or some other misperception or misinterpretation in our senses. So these are under the certain psychiatric illness. So these are the hallucinogens. There are certain homeopathic medicine which has all these symptoms. Next is stimulants. So generally stimulants are used to activate our homeopathic medicines or generally used to activate our central nervous system or our neural pathway. So stimulants are generally like Nux vomica, Thuja, Aconite, Pulsatilla, Phosphorus, Lachesis, Arsenic album, R-Cyode, Platina, sepia, natramure. So these all drugs are said to be a stimulants. So generally these are having the deeper action on our central nervous system. So that's why these are going to categorize into a different category. There are some other more classification of drug like mother tincture, mother solution, and mother powder. It is not written in this slide because today I am only going to focus on the pharmacological part. But beside of this, we should also remember this three more classification, that is mother tincture, mother solution, and mother powder. Okay, so these are as per our pharmacy. But in general, when we talk about the classification, so they are in as per the modern pharmacology. So first we have to know about this, then we will go for the homeopathic part. So depression, as we know, this is acting on brain, this is acting on the sodium potassium pump or channel on the dendritis. These are going to slower our messengers and then they are going to give a better response on the central nervous system. So this is generally used for the patient of anxiety neurosis or those patients who are very restless mentally. So these are the depressant. Examples: alcohol or cannabis or ketamines, opioids. So generally our medicines are also made by this category. So we should always remember one thing: our medicines are generally going to act on CNS. Either you are treating with some skin illness or some other local maladies or some other physiological or some physical illness, but ultimately when we observe the totality of symptom, so there are some mental alterations also seen in our patient. So these are one of the best example to show the action of drug on CNS. That's why our medicine has the holistic concept. They are not going to act on any particular part. They are going to act from mind to body or any particular area. So this is generally related with that. Next is hallucinogens. So generally they are going to alter on our physiological or the senses of our body. So they are going to have a misinterpretation in our feelings, in our senses, or in hearing also. There are certain cases where you can see patient have some other like a false image or perception, like they have somewhat optical hallucination, auditory hallucination, somatic hallucination, olfactory hallucination. So generally these are the different types of hallucination. In optic hallucination, they are going to misinterpret it with certain images which are not actually present. In auditory hallucination, they have some or they have some abnormal sounds like hammering or some other noisy or some other loud sound. Actually, they are not to be around the patient, but they are going to hear this abnormal senses. So these are generally the hallucinogens. So when we have such patients of abnormal senses, so we also go for our particular medicines like calimure, califos, phosphorus, or some other veritrum group, vegetable group. We have certain medicines which are one of the best hallucinogens. So generally it is also going to important classification as per the modern pharmacology. Now moving towards the next part. So these are general examples which are used for this hallucinogens in modern pharmacology. Beside this, we can also go for our homeopathic medicine. But again, the constitutional part, the totality of symptoms, the simillimum plays a major role in selecting those drugs which are said to be the hallucinogens. Not only the Cali group or the vegetable group, there are certain medicinal or the acid group which has that particular affinity to act on our nervous system or sensory organ. Now, when we talk about the stimulants, so they are generally go for the depolarization. They are generally initiate our impulses via the nervous system. They are generally boost up our nerve conduction. So generally, stimulants are those drug substances which increase our neural pathway along with some other metabolism in our living entity, like blood pressure, like heartbeat, like body temperature, like some other mental or the impulses through the nervous system. So they are said to be the stimulant. So they are generally used for those pathological conditions in which there is lethargy, there is more depolarization or the repolarization or somewhere the pathological condition on CNS, central nervous system. So generally these are used to stimulate, to give impulses, to generate impulses in our living body. Generally when we talk about the action of drug, so we used to say that our medicine act on the CNS, our medicine act on the nervous system. But beside this, we should also understand the action of this neural pathway, how the medicine enters in this receptor, how they are going to act in this particular cellular region, how they are going to transfer the impulses from one neuron to another neuron, how they are going to act inside the nucleolus, which is the part of nucleus. So these are all to be the part of pharmacology which has to be elaborated more and more in our homeopathic sciences. Got it my point? So here stimulant is not only just to give or raise our metabolism, it is going to also increase all the functioning physiology or the neural system, neuroendocrinology in our human entity or any living entity to maintain that particular condition or to compensate our pathological condition. So this is the general example or justification for the stimulant as per modern pharmacology. So we have to understand this. Whenever we took any deep acting medicine, like suppose generally in hypothyroidism, when we used to give thyroidinum, natramure, or some other medicine which are from the deep action or some other constitutional medicine. So how this medicine act on the neuroendocrinology, how they are going to act on our metabolism, how they are going to act on a different cellular event, how they are going to act on different lymphatic channel, how they are going to act on different system of human body, how they are going to maintain our electrolytes. So they are a different dimensions. We have to learn about this. We can't say just take this natriumate and the T3, T4, TSH level is going to normal. We have to understand in the natriumate, this NaCl, this element, this salt, when it is given to the high dilution, so how this NaCl particles or their formulary structures going to act on our nervous system. It is very deeper part. In every presentation I want to focus more on pharmacology. Why it is important for us? Because we need a complete explanation. Just to give the medicine, it is not to be a sufficient, and it is not justifiable for our body. As a homeopath, this is again my request to every physician, to every doctor, to every homeopath, to every teacher. When we teach our students to know about the homeopathy,
Yes, Dr. Suraj, it's really a very good session. You really narrated everything about the drug as well as the medicine. But you have not gone through the remedy. Is it? Is there anything more to share? What happened? Is there any problem with you? Is there any network problem? We can see you, but
sir, is visible,
yes,
sir?
no, no, only screen sharing is not visible. You may stop screen sharing and restart uploading.
Okay, sir. This part is not going to complete it, sir. It
No.
is just starting of this drug. After
Okay, it doesn't matter. We can have another session. Robert, doctor, what is your opinion on this session? Yes.
Thank you, Dr. Hanesh ji, and everyone. Thank you. Congratulations, Dr. Suraj Singh Bhadoriya ji. Very nice presentation. Pharmacology, many kinds of pharmacology, inhalation, injection, smoking, and ingestion, and classification of pharmacology, modern pharmacology, action, stimulation and action of drugs, CNS, central nervous system. Very nice presentation, Dr. Suraj Singh Bhadoriya. Very thanks, Dr. Suraj Singh Bhadoriya.
I think there is some network problem with Dr. Suraj. His audio is not connected now, and we have to wait for him to rejoin. Until then, we can have a discussion. And those who want to, I invite Dr. Remadevi Ambari to say a few things on this particular session. Dr. Ambari Madam, are you there in the session? Dr. Tashit and Ilari, you can also speak your opinion on this session because drugs are being used in a different way. And homeopathy, we use the medicine in a different way. We all know that there are several different
Hello,
substances.
Ganesh.
Yes,
I was not able to unmute. That's right.
okay. Okay, now you're
Okay. So it was a very nice session. So I was eagerly waiting for the differentiation to know the the drug, medicine, and remedy. I was eagerly waiting, but unfortunately it is blocked, I think. Anyhow, he will continue it. We will have another session. It was very nice presentation. So long as it is described as it's halogens and all, it was so nicely presented. Thank you, thank you a lot. Please come again and fill the seat, complete the entire session. You should know the difference between drug, medicine, and the remedy. Just so nicely prescribed,
Yes.
narrated.
Yes, we all know that there are different substances are being used in homeopathy for making medicine. So those substances which are being used as for making this medicine, it can be called as drug substances. And as you all know that our we use those from vegetable kingdom, animal kingdom, from other sources, that is just like sun, light, X-ray, all those things. So there are different methods, and the different substances can be used. But when you use something, I think Dr. Veena is here. Dr. Veena, you can say something on that. Are you there? We used to say that imponderable. But all those substances we use, we know that the animal kingdom, from animal kingdom, we used almost all. Yes, Dr. Suraj is again trying to join, but he's not a join. And yes, Dr. Suraj, your audio is not connected, Dr. Suraj. I think there is there is some network problem with you. If you are not able to join from the laptop, you can just come out from your mobile, and you can go without the slides, no problem. I think you can hear me. If you can hear me, you can just shake your head so that we can understand that you hear us. You are visible. Your audio, your audio is not connected, so we can't make you a co-host. Only if if a person connecting his audio, then only we can make him co-host. That is the primary requisite for making a person co-host. Dr. Jayalalitha, you want to say something from your heart? After results, sir, you can speak some more time. I shall join shortly.
Hello, Dhanesh ji. Hello, sir.
Yes, yes, yes.
Uh, kindly share on Dhanesh ji mobile number.
Yes, that I will
Dr.
share. That I will share after the session. Don't worry.
Good.
Dr. Suraj
Uh,
has
Dr. Dr. Suraj Singh Bhadoria ji joined, but
yes,
network
still,
problem.
but still the audio is not connected. That is the biggest problem. I shall contact him through my phone. So that somebody for a while. And now you're hello Suraj, Dr. Suraj, your audio is connected now. You can directly come out. You please unmute.
My voice is audible, sir?
Yes, yes,
Yes,
yes.
yes, yes.
Now it
Okay,
is
okay,
audible.
sir. Some net issues are there, sir.
Yes, yes. I shall make you co-host once again. Okay.
Okay.
Oh, okay. Now you are the co-host. You can speak.
Okay, sir. Sir, actually today we just started with the drug part. There are
Yes, again the network failure is there. So anyway, Dr. Suraj has presented beautifully about the drug, and we have to go through the medicine and the remedy in the next session, I think. Until then, we can have a discussion. As you all know that today is the Easter day, and most of the people are celebrating Easter during this daytime all over the world, and here in India also we also uh, join the celebrations. I think that's the reason why most of some of our participant has left as soon as Dr. Suraj's network failed. And on April 10th, we have a wonderful session coming at Delhi. And Delhi, at the time, there will be World Homeopathy Conference is going to be done, celebrated along with the homeopathic Dr. Hahnemann's birthday celebration. And the National Council of Homeopathy has made elaborate arrangements for the same. They are expecting more than 3,000 doctors at this venture, where our president is about to inaugurate the session. So that is one of the thing that will go into the world. All over people will know about the celebration, and we are also some of our active participants are there in Delhi also participating. Dr. Purana has directly come out with his video inviting all of us. And those who are interested can, those who have, those who are interested in going to Delhi, they can definitely join the session. We have already uh, uh, published the joining letter or how to register all those things in our uh, groups. All of you might have seen that, and you have responded. Some of you have responded in a good way also. So here in our IFPH room also, we are celebrating the day in a different way. At the Hindi session, we have our first year celebration is also on the same day. So there is a big program going on the night of April 10th, that Hindi session from 7 to 8, and from 8 to 9 we have a presentation from Dr. Beatrice from Germany about the life history of Dr. Hahnemann. And thereafter, we will have a session from Dr. Kathy May Lehman from America. She will be talking about the post-COVID scenario and homeopathy. So these are the subjects which are very, very interesting one and very relevant one also. So I invite all of you to join the session without fail, because that is the time to celebrate our master's birthday. Giving, we get all of you can also give his your tribute to Dr. Hahnemann for this wonderful session on that particular day. If anybody have any suggestion, you can just open your video, audio. You can just raise a hand and you can speak now. At Malayalam session also, we have a celebration from 9 to 10. An IAS officer from Kerala is inaugurating the same, and one professor from Sarada Krishna Medical College will be talking about the life history and evolution of homeopathy on that day. And there will be a public meeting also for that. We are releasing a paper program on that day. Dr. Suraj was trying to join the session, but unfortunately his network is not enough to present the session. That's why he just left the session by 10 minutes early. And definitely we will arrange a second session on the same subject so that we can complete the session. It's a big subject because we just only covered only the first thing about drug, and we have to go through medicine and then remedy also. So it is the time to wind up the session. I invite as Dr. Suraj is trying to join again, but still the audio is not coming up. Anyway, I invite Dr. Ambadi Madam to say what are thanks to the session, so that we can go to our next session.
Anyway, by our unluck, the net was having some problem, and it was not able to complete. Anyhow, Suraj, don't worry. It's a very nice section. It's a very nice session. You can very well continue the session the next time. It was so nice. We were really waiting for this comparison and all. Thank you a lot. I express my thanks to in favor of me as well as in favor of the IFPH. Thank you a lot.